I'm Denisa Kurtaj. I'm part of Agricultural University of Tirana. My topic is about health as a motive for choosing healthy foods. Introduction, literature review, methods, results, and conclusion. The objective of this research is to explore the question, does good health motivate individuals to choose healthy foods? It is essential to understand how people perceive the value of health in relation of food because this can have a significant impact on their dietary choices. The decision to choose nutritious foods is driven by many factors, not just health. Our food choices are shaped by a complex interplay of various factors such as individual preferences, cultural contexts, social norms, and access. Although health is an important motivator for making healthy food choices, and it is not the only, there is a strong connection between our diet and our overall health, and this has been proven through extensive scientific research. Studies demonstrate that a balanced, healthy diet can help to reduce the risk of various diseases including cardiovascular disease, diabetes, obesity, and some types of cancer. According to FAO, Food and Agriculture Organization in 2023, around 2.4 billion people, mostly women and those living in rural areas, were unable to access nutritious, safe and sufficient food throughout the year in 2022. The ongoing impact of the pandemic on people's disposable income, the increasing cost of healthy food, and the general rise in inflation have left millions of people without access to an affordable health. The cost of maintaining a healthy diet in Albania between years 2017 and 2021. To maintain a healthy diet, an Albanian consumer needs a minimum of $4.4 per day or around €4 per day. This figure has seen an increase due to inflation, which has been on the rise since 2020, driven in part by the ongoing effects of the pandemic. Additionally, the cost of a healthy diet has increased globally by 4.3 compared to 2020 and by 6.7 compared to pre-COVID-19 pandemic levels in 2019. As of 2021, the average cost of a healthy diet worldwide stands at 3.6 in Europe and worldwide. And in Europe, the figure is slightly lower at 3.2. Uh, about 400,000 people in Albania cannot afford a healthy diet in 2021, which is an improvement from the estimated 600,000 in 2020 due to the pandemic restrictions. The availability of vegetables and fruits is insufficient to meet daily dietary requirements in Europe, and thus the above-mentioned foods are crucial for a healthy diet. Food of animal origin, legumes, nuts, seeds, vegetables, fruits, fats, and literature review. I did the analysis on the value chain at the producer level to better understand how people's views on food production methods affect their motivation to choose healthy foods. We need to focus on the production stage in Albania. Consumers often associate healthier options with specific productions practices such as organic farming, sustainable agriculture, or organic foods. If Eurostat data shows a correlation between a preference for healthy foods and a positive perception of sustainably produced goods within Albania, it would indicate a link between health motivation and production-related perceptions. Therefore, it is crucial to examine people's perception of food production within the value chain, particularly during the production stage in if Albanian consumers prefer foods that are produced using environmentally friendly or sustainable methods, it could indicate that they consider such foods to be healthier and more conducive to overall well-being. By studying Albanian consumers' perception of the production process within the value chain, we can determine if particular production methods or practices are crucial to their dietary choices. By analyzing data from Eurostat, we can gain valuable insights into various aspects of food production in Albania. These may include people's preference for locally sourced produce, their attitudes toward organic farming, and their opinions on sustainable practices of or fair trade. Which are the factors that influence the choice of healthy foods? The link between various socio-economic factors and healthy eating habits is significant. Age, gender, income, and education are some of the most crucial factors that determine this link. Studies that have focused on these factors conclude that individuals within higher socioeconomic status are more likely to maintain the first choice of a healthy diet is age. The first hypothesis is older ages are expected to positively influence the selection of healthy foods. A study conducted by Lealuca in 2007 revealed that women aged between 50 to 60 years tend to report healthy eating habits more frequently than younger women. However, for men, the trend for healthy eating was only observed for 60 years old and was not statistically significant. Eurostat data shows that older individuals in Albania are more likely to make healthier food choices. This inclination towards healthy eating could be due to various factors such as an increased awareness of health-related issues with age, accumulated knowledge known about nutrition, and a tendency toward more health-conscious behavior due to existing health. The second is gender. Women tend to influence more positively the selection of healthy foods compared to men. Health and high quality are the most important characteristics of healthy food for both genders, but women tend to prioritize them more than men, according to Brula. Regardless of age, people view food through the lens of health. La Luca 2007 conclude that younger people often prioritize food quality while older people tend to focus more on health properties. When it comes to choosing food products, men tend to be influenced by advertisements and curiosity, while women are more likely to be guided by product safety and health considerations. Third is income. Higher income is expected to positively influence the selection of healthy foods. Individuals with limited financial resources may perceive healthy eating habits as costly, possibly leading to lower consumption of healthy foods. According to Brüller, individuals with lower income are often motivated by prices and quality guarantees, whereas wealthier consumers are strongly motivated by product safety and health considerations. Additionally, according to Sheffy and Reni, willingness to pay higher prices for healthy foods appears to increase with income. However, a Norway study found no significant effect of income on the selection of healthy foods. Lastly, while income can be a determining factor for consumers who choose healthy products, the correlation is not very strong, according to a research did by Gillette and the fourth is education. Education has a positive effect on the consumption of healthy foods. According to Laluca, self-education can lead to differences in dietary habits between low and high education groups. This is because self-education can increase knowledge, skills, and awareness of healthy eating habits, and people with higher education tend to be more willing to pay for healthy foods. Uh, Wardle found that the relationship between educational level and healthy eating was twice as strong in women compared to the focus of this research is will be on consumers who will serve as the primary data source. To gather this data, I did a questionnaire consisting of two main sections. The first one will gather information on demographic variables, and the second one will include questions from which the research hypothesis will emerge. I did approximately 200 questionnaires chosen at random. The margin of error for this sample size is estimated to be 7%. The variables are in this table. The model that I used is the multiple linear regression model, and in my case, epsilon or dependent variable is willingness to choose healthy foods, and independent variables are age, gender, income, and education. The multiple linear model is the most appropriate model to use in this research since the dependent variable is a quantitative data have been collected from Eurostat regarding health and the healthiest eating age groups. Once data was collected, it was analyzed and processed in Excel. The result of the study are presented below. To determine which age group tends to eat healthier, a thorough examination of various factors such as dietary patterns, food choices, and lifestyle preferences is required. This detailed analysis will delve into findings from a comparative study of eating habits across different age groups, aiming to provide insights into the nuances that contribute to healthier dietary practices. Understanding eating habits is crucial for public health initiatives and policy development. This study investigates the dietary behaviors of different age groups, seeking to identify patterns and variations in healthy eating practices. The study employed a mixed method approach that combined quantitative surveys and qualitative interviews to gather comparative data. The study population was categorized into different age groups: children 5 to 12 years, adolescents 13 to 19 years, adults 20 to 50 years, and older people, elderly, 51 plus years. The survey included questions about daily food intake, food preferences, awareness of nutritional guidelines, and barriers to adopting healthier food choices. Those were provided in-depth insights into the socio-cultural factors that influence dietary. We gather some data about Eurostat by age and by gender, as you can. The results are children between 5 to 12 years old. It was found that children tend to prefer healthy food choices more than previously expected, and this can attribute it to the influence of parents and school feeding programs. The study revealed that fruits, vegetables, and whole grains are the most favored options among children. However, there is a growing trend toward processed food, which is believed to be influenced by marketing and family members. Adolescents 13 to 19 years old have a varied dietary profile. Although many of them acknowledge the significance of healthy eating, their choices are largely influenced by social factors. Fast food consumption is quite high among them, influenced by peer preferences and limited awareness of nutritional consequences. However, a considerable subgroup of adolescents show a proactive interest in the healthy food, and adults 20 to 50 years old, the adult age group displays a variety of dietary patterns. Busy lifestyle often result in dependence on convenient but not necessarily healthy food choices. Some adults consciously balance their diet with a variety of food groups, while others struggle with time constraints and the perceived affordability of healthier options. Elderly, 51 plus years old, older adults prioritize nutrition-dense foods due to perceived health benefits and emphasize traditional and homemade meals. Prevalent dietary restrictions are and limited access to certain foods were issues for this group due to health conditions. Conclusions from the study are children have a tendency to prefer healthy food choices, and this is because of parents and school feedings. This indicates the crucial role of early exposure and education in shaping dietary habits. This inclination toward fluids, vegetable, and whole grains suggests that children are open to nutritious options where presented to them. However, despite the preference of healthier options, there is a growing trend toward processed food, and this highlights the need for continuous efforts in promoting healthy eating habits and counteracting the influence of unhealthy food marketing. Adolescents have a wide range of dietary preferences that are significant influenced by social factors. Due to peer preferences and limited awareness of nutritional consequences, there is a high consumption of fast food among adolescents. On the other hand, a notable subgroup of adolescents shows an active interest in healthy food and recipes, indicating potential for intervention and education targeting this demographic. Adult age group exhibits a range of dietary behavior that reflect the diversity of lifestyle and preferences within this demographic. Busy lifestyles often lead to a dependence on convenient, albeit less healthy food options. While some adults make conscious efforts to balance their diets with a variety of food groups, others struggle with time constraints and affordability issues when opting for healthier options. Many older adults focus on consuming nutrition dense foods because they believe it has several health benefits in general. The analysis emphasizes the intricate interplay of various factors that affect dietary habits among people of different age groups. These factors include the influence of family and society, personal preferences, and health considerations. To promote healthy eating habits effectively, strategies must consider these diverse factors and be customized to meet the specific needs and challenges of each. Thank you.